don't need fancy smancy, right? You can give us the backyard and we'll fill it all in and have our own fiesta. Is the president open to that?
I had no idea she was going to ask that question. I just want to preface that.
This week, the Democrats have chosen illegals over hard-working Hispanic Americans during Hispanic Heritage Month, causing the White House to cancel the celebration with the president. Is the president open to letting the Hispanics, who overwhelmingly voted for him, have their own fiesta in the White House lawn opposed to the fancy, we don't need fancy smancy, right? You can give us the backyard and we'll fill it all in and have our own fiesta. Is the president open to that?
I had no idea she was going to ask that question. I just want to preface that. I've never met you. I just want to say that, but welcome to the briefing room. I love your energy. I can't personally unilaterally promise the South Lawn grounds. We have some construction going on out there, but I know that everyone here views it as very unfortunate we had to cancel or hopefully just reschedule the Hispanic American Heritage Month event, and it's because we are working around the clock during this government shutdown. When the Democrats vote to reopen the government, that event will be back in the planning stages. You're welcome. Brian, go ahead.
Thank you very much. Welcome to the briefing room, by the way. I was with the Secretary of War and the Attorney General in Memphis just the other day as we were going to a command center. And I noticed a billboard along the highway that said, "Memphis welcomes the National Guard." Now, what is your message today to Democrat mayors watching us right now that suffer from TDS and they cannot get Trump out of the way to saving their city, Portland being one of them?
They should do the right thing by their citizens, Brian. They should call the president, they should call the White House and say, we want to work with you. And in Memphis, we are seeing some cooperation. As you saw from that billboard, the people of Memphis are loving this, and they are very grateful for the federal government's efforts. And federal law enforcement is there. We're working alongside local law enforcement. We'd like to see it ramped up a little bit because we want to make progress, and we want to arrest as many bad criminals as we can. Since Monday, I do have some updated statistics from the Homeland Security Council this morning. Since Monday, 153 arrests have been made in Memphis, including 5 gang members. 48 illegal guns have been seized, and 5 missing children have already been recovered. Last night, 60 arrests were made and 21 illegal firearms were seized. Arrests from last night include a suspect wanted for rape of a child under 13, first-degree murder, breaking and entering, aggravated assault, illegal drug possession, and many more. So we continue to see good results coming in through Memphis, and the president is very excited about making Memphis safe again. In the blue.
Thank you. At the top of the briefing, you made a statement about that the Democrats are interested in giving health care to illegal immigrants.
Yes, they are.
U.S. law already prohibits that. It's a 1996 law saying that they cannot give unauthorized immigrants any federally subsidized health care coverage through Medicaid, the Affordable Care Act, or the Children's Health Insurance Program. There seems to be a disconnect in the messaging.
Are you denying that Medicaid money has never gone to illegal aliens in the United States of America?
I'm asking you if you can explain the disconnect in the message.
I most certainly can. The Democrats' proposal, their continuing resolution, let me just reiterate, the Republicans' continuing resolution was a clean continuing resolution. There was no partisan politics injected into it. There were no conservative wish lists injected to it. What the Republicans want, and still want to this very second, is a clean continuing resolution to fund the United States government. What did the Democrats want in their continuing resolution? They inserted a provision to undo a provision in the Working Families Tax Cut, the One Big Beautiful Bill, that ended taxpayer-funded health care illegal benefits for illegal aliens. Democrats' proposal would require Medicaid to pay more for emergency care provided to illegal aliens than Medicaid does for American patients who are disabled, elderly, or children. And this bill would have also allowed California to continue a gimmick that funds its Medicaid for Illegals program. Those are things that we ended, the Trump administration ended, with the passage and the signage of the One Big Beautiful Bill. And it is an undisputed fact, a fact that under the Biden administration, illegal aliens were absolutely receiving taxpayer-funded health care benefits. In fact, in fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142% from the previous year to $9.1 billion. That's $9.1 billion taxpayer dollars that were going to emergency services for illegals. Between President Trump's last full fiscal year under his first administration and Joe Biden's last full fiscal year, Medicaid spending on emergency services for illegal immigrants nearly tripled. There was an increase of 196% between 2020 and 2024. And I have a chart here for you, and I'm more than happy to email it to you. I'd also like to add, because some were asking dishonest questions yesterday about emergency rooms. In Southern California, according to healthcare professionals in 2023 under the Biden administration, Southern California's, quote, entire healthcare system was being bombarded with illegal immigrants and forcing American patients to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000 illegal immigrants made 20,000 visits to the city's health system in 2023. Leaving an uncompensated bill totaling over $10 million. So when a legal alien goes to the emergency room, who's paying for it? The American taxpayer. The Maine Safety Net Hospital in Denver had to turn away patients due to the massive influx of illegal immigrants into the community. And UC Health Hospitals in 2024 reported their system was under stress from an increasing number of migrants. As a result, according to the head of emergency departments and urgent cares across the hospital system, quote, access is impeded for everyone. These are healthcare professionals who dealt with this directly, and there's a lot more where that came from. It is an undisputed fact that Democrats want to give taxpayer-funded healthcare benefits to illegal immigrants, period.